Today, I rise to express my strong opposition to partisan attempts to engage in a fast-track process to take health insurance away from hundreds of thousands of individuals in my state and millions across our country. In Michigan alone, 887,000 people are in jeopardy of losing their health coverage if Republicans have their way and repeal the Affordable Care Act without a replacement. Important protections for people with pre-existing conditions will disappear. And not only will they lose them, so will their spouse and children. We will be voting to repeal reforms that have benefited seniors and save more than 5 million beneficiaries an average of over $1,000 in drug costs in 2015. Repealing the Affordable Care Act will significantly increase drug costs for those seniors and threaten long-term solvency for Medicare. Republicans are rushing a process that increases Medicare costs for seniors and weakens the program for future generations. Our nation's seniors have worked hard their entire life and deserve our best efforts to ensure they can depend on Medicare to help them enjoy a dignified and secure retirement. Over 1 million seniors in Michigan are enrolled in Medicare, and they deserve a program that allows them to cover the cost of prescription drugs and other health care services that they need. Since 1965, Medicare has done a tremendous job of getting seniors the care that they need, and we should be working to strengthen this successful program, not putting it at risk. Let's be clear. Reforms in the ACA extend the solvency of Medicare by over a decade. Let me say that again. It extends the solvency of Medicare for over a decade. Given these challenges, we have to ask, why are we rushing to dismantle these reforms? We are rushing a process that will ultimately hurt the Medicare program, our nation's seniors, and so many others. Mr. President, some of my colleagues on the other side of the aisle suggest that we can simply keep or quickly reinstate the popular parts of this law, like preventing discrimination based on pre-existing conditions, allowing children to stay on their parents' coverage until they are 26, and helping seniors afford their prescriptions. Mr. President, I would pose this simple question to any of my colleagues advocating for repeal. What comes next? Show us your plan. Just show us your plan. Former Governor Cuomo of New York famously said, "You can campaign in poetry, but govern in prose." Well, we are now facing a majority that campaigned on a bumper sticker and is trying to govern with an IOU. Enacting a repeal of the ACA that takes effect at some undetermined point in the future will create chaos in our insurance markets. Healthcare reform is not a standalone program that can be removed overnight without creating widespread ramifications for our economy. Yesterday, I attended the North American International Auto Show in Detroit. And as a Michigander, I'm always thinking about cars. So let me suggest an analogy. Many Republicans in Congress talk about the ACA like it's some sort of aftermarket addition on a car. A flashy rear spoiler, perhaps, or new rims that can just be unbolted and removed. Well, the ACA is actually the anti-lock brakes that keep a driver from getting into an accident in the first place, and the airbags that deploy to protect everyone inside when the worst happens. I agree our healthcare system needs a tune-up, but we cannot start ripping out safety features without a plan to help keep us safe on the road. We need to fix the Affordable Care Act. We need to do more for small business owners who want to do right by their employees and provide them with quality, affordable health care coverage. And I have offered and supported several proposals to fix the Affordable Care Act, including measures to help our nation's small businesses. Mr. President, I'm ready to work with my colleagues across the aisle to improve this law. However, repealing the ACA without showing the American people their plan for replacement is quite simply irresponsible. I understand Americans want to see positive changes to the Affordable Care Act, and I agree with them. We should be working together to enact bipartisan improvements through regular order not fast-tracking repeal. The fact is that most Americans do not want to have this law repealed entirely. In the New York Times, a woman named Patricia Meadows from Macomb County in Michigan, who voted for President-elect Trump, stated that she hoped that President-elect Trump would not repeal the Affordable Care Act. Ms. Meadows revealed that because of the Affordable Care Act, her daughter was able to obtain insurance coverage for just $50 a month. Another constituent of mine from my state, Ben Irwin, revealed to CNN that the Affordable Care Act allowed him to take his dream job at a small firm that didn't provide health insurance. Because of the ACA, Ben was able to get private insurance at an affordable cost. Without the ACA, he would have been forced to work at a larger company just to have access to affordable health care. And Ben's story is not unique. I have heard from countless entrepreneurs that the Affordable Care Act ended job lock and has enabled them to start their own businesses and pursue careers and dreams they otherwise would not be able to pursue. I heard from a constituent in Saline, Michigan, who contacted my office to say that the ACA provided her with the coverage needed to fight her son's aggressive cancer. The same woman later discovered during her first appointment after gaining her own ACA coverage that she too had cancer. The ACA gave her and her son coverage that they needed to fight their cancer without fear of being kicked off of their insurance plan. I've also heard from a father in Traverse City, Michigan. He contacted my office to say that the expanded health coverage under the ACA literally saved his son's life. Before the ACA, his son only had access to emergency room care. And this father often wondered, why is it that I had to wait until my son tried to kill himself before I could get help? And now, due to the ACA, this father and his son have the health coverage they need to appropriately treat his son's mental illness. These stories are just a fraction of the thousands upon thousands of stories my staff and I have heard about how the ACA has positively impacted their lives. Mr. President, I'm asking my colleagues to just take a moment and think about the individuals that they will be hurting. We are talking about mothers and fathers, children, seniors, and even our nation's veterans. As a former lieutenant commander in the U.S. Navy Reserve, I understand the tremendous sacrifice our men and women in uniform undertake to defend our freedom. I believe that we have a duty to honor their service to the best of our ability, both during and after service. Since the passage of the Affordable Care Act, hundreds of thousands of uninsured veterans have gained insurance coverage. Between 2013 and 2015, when key provisions of the Affordable Care Act were implemented, such as the Medicaid expansion and the private exchange, the number of uninsured veterans decreased by 42%. Uninsured rates for spouses of veterans and their dependents have decreased as well. These veterans represent a small fraction of the individuals that this fast-track process will hurt. I have proposed an amendment that will simply require Republicans to show us their plan for providing for these veterans and health benefits that they deserve before they vote to repeal the ACA and take it away. Every American deserves to know what will happen to their health benefits before Republicans vote to take them away. Please, just show us your plan. But our nation's veterans who have risked their lives and health to keep us safe should have the right knowing how Republicans will ensure veterans that gained health care coverage following the ACA do not lose their coverage. The damage of repealing ACA stretches beyond affected individuals and families. It will disrupt hospitals, businesses, and create tremendous economic uncertainty. Hospitals in my state, especially rural facilities, are absolutely terrified about what the ACA repeal means for them and their ability to stay open and to serve patients in their community. Executives from 2 hospitals in rural Upper Peninsula of Michigan
have told my office about how coverage expansions under ACA have allowed many critical access hospitals in Michigan's rural communities to afford their operations for the first time ever. If the ACA is repealed, they tell me that these critical access hospitals will be forced to close, forcing residents in rural communities to drive over 2 hours to seek hospital care. A recent report by the Urban Institute predicts that if the ACA is repealed without replacement, uncompensated care costs sought from hospitals and doctors will reach $1.7 trillion over the next 10 years. This will bankrupt many of our nation's hospitals, killing jobs and severely limiting access for their patients. Mr. President, we can and must do better. We owe the American people a better healthcare system and not a bigger deficit. Unfortunately, that is exactly what we're going to be getting under repeal. This budget resolution before us would increase annual deficits by upwards of $1 trillion. It will add more than $9 trillion to the federal debt over 10 years, leaving our entire economy on shaky ground while ripping health care from millions of Americans. In their rush to repeal the ACA and fulfill years of campaign promises, I am concerned my colleagues on the other side of the aisle have not fully considered the far-reaching ramifications that their actions might have. They have refused to slow this process down and fully think through the actions that they are about to take. A University of Michigan study published in the New England Journal of Medicine just last week found that Medicaid expansion in my state alone generates at least 30,000 jobs every year. In addition, a recent study by the nonpartisan and independent Commonwealth Fund found that the ACA repeal could lead to significant economic disruption and substantial job losses in every state, including over 100,000 private sector jobs in Michigan and 2.6 million jobs around our nation. By any and all means, the level of uncertainty repealing the ACA will create is bad business practice, and I assure you it is very bad for business. We owe it to our constituents to do our homework, govern with facts, and be informed. Republicans have refused to listen to healthcare experts who tell them that enacting a repeal of the ACA will cause insurance premiums to skyrocket. Republicans have refused to listen to economists when they tell them that this will spike our national debt and lead to substantial job losses. Republicans have refused to listen when the nonpartisan Congressional Budget Office has told them that repealing the Affordable Care Act will cause millions of Americans to lose their health coverage. And Republicans have refused to listen when actuaries state that the ACA repeal will weaken Medicare and increase drug costs for seniors. Republicans have refused to listen when Democrats have simply asked them to slow down, come to the table, and work in a bipartisan way to find solutions to make the healthcare system work even better. Instead, Republicans have opted to move full steam ahead, and this process will certainly make America sick again. Why move forward with this fast-track process to repeal the Affordable Care Act? Why repeal all of the great things that Americans appreciate about the Affordable Care Act instead of just making it better? Mr. President, Republicans are trying to take us backward. They are moving ahead with a dangerous process that will hurt working-class Americans, hurt seniors, and hurt our nation's most vulnerable, while providing a huge payout for wealthy Americans and special interest. Republicans are voting to give billions in tax breaks to corporations and the wealthy and raising taxes on the rest of us. The Nonpartisan Tax Policy Center estimates that the top 1% of earners would get an average tax cut of about $33,000, and individuals in the top 1/10 of 1% would get an average tax cut of about $197,000. If you're not in this group of American earners, then tough luck. This legislation will not help you. We need to get serious, put politics aside, and do what is best for the American people. This fast-track repeal of the Affordable Care Act is not the answer.
I stand ready and willing to work with my colleagues on both sides of the aisle to make our nation's healthcare system better. We cannot simply repeal this law and leave the American people with another empty IOU. Mr. President, I yield the floor and suggest the absence of a quorum.